So what is an antenatal screening programme? Screening tests, whether antenatal or at any other time in your life, are used to find people of higher risk of a health problem. This means they can get earlier, potentially more effective treatment or make informed decisions about their health, or in the case of antenatal screening, that of their unborn child. Imagine a sieve where the majority pass through the sieve. These would be classified as low risk of the health problem being screened for. Those who do not pass through will be in the higher risk category and offered further testing, usually diagnostic, and it will establish if the health problem actually exists. It's important to know that screening tests are not perfect. Some people will fall into the higher risk category when they do not have the health problem. Screening tests will not tell you for certain if the problem exists. Only the diagnostic tests can do that. So why are screening tests important? They enable us to ascertain if you may be at high risk of being affected by conditions which may adversely affect you or your baby. This will then enable the appropriate care and management to be discussed and agreed to achieve the best outcome according to your wishes. What are the different tests about? During pregnancy, there are several screening tests available. The booklet, Screening Tests for You and Your Baby, is an excellent resource and explains all of these tests fully. Your GP surgery should have copies of this, and it is best to get a copy as soon as possible so that you're aware of the tests that your midwife will be offering you. The first of these is a blood test, which should ideally be taken before 10 weeks of pregnancy. The blood test includes an infectious diseases screen. These are hepatitis B, HIV, syphilis and rubella. These tests are recommended to protect your health through early treatment and care, and to greatly reduce any risk of passing an infection onto the baby, your partner or any other family members. Thanks to screening in England, we now have the lowest ever rate of mother-to-child HIV transmission. It's also very important that if you develop a rash-like illness while you are pregnant or come into contact with someone who has, you contact your midwife or doctor straight away. Should you decide not to have this screening test, you will be offered it again at 28 weeks. You can request retesting for hepatitis B, HIV or syphilis at any time you change your sexual partner or if you think you're at risk. You'll also be offered a blood test for a hemoglobinopathy screen. This is for inherited blood disorders, which are called sickle cell disease and thalassemia. There are also less common serious hemoglobin diseases that may be found with this test. These inherited disorders require both parents to have an affected gene. They may not be unwell or aware that they have this inheritance, but may have an affected child with a serious, lifelong and possible life-limiting condition. If both parents are found to be carriers to these conditions, a diagnostic test will be offered to establish if their baby is affected. This is why it's important that the blood tests are taken as early as possible into the pregnancy, so that any diagnostic testing can also take place as soon as possible. Ultrasound scans are also screening tests, and it's important to realise that these are more than an opportunity to see the baby and get a picture. The sonographer is looking to see if they can see any obvious problems. The combined test consists of a scan at around about 12 weeks gestation and a further blood test. This is in addition to the ones we spoke about earlier. This blood test is usually taken immediately after the scan. The details of both of these are then evaluated to produce a risk of whether the baby may be affected by one of the three most common chromosomal disorders, which are Down's syndrome, which is referred to as T21, and Edwards or Patau's, which are T18 and T13. You can elect to have no screening, in which case a simple dating scan will take place. You can also select to have just Down's screening alone, or just Edwards and Patau's, or indeed all three. The choice is yours. In brief, children affected by Down syndrome will have learning disabilities. It's impossible to say to what extent this will be. There will also be other health-associated problems, but life expectancy is now around 60 years old. Unfortunately, babies affected with T13 or 18, that's Edwards and Patau's, do not usually survive. The second scan at around 20 weeks of pregnancy is also a screening test and is seeking to look for physical abnormalities in the baby. It can't find everything that might be wrong. Specifically, the baby's bones, heart, brain, spinal cord, face, kidney and abdomen are looked at in detail. So how do you prepare yourself for these tests? The most important thing is to be well informed. The more you read, the better informed. Again, screening tests for you and your baby will help to enable you to make an informed choice. Your midwife or GP will also be happy to discuss any concerns you may have. There's also a great website called Antenatal Results and Choices. This gives lots of information about tests and also possible results. Using a search engine, put in Antenatal Results and Choices and you'll find yourself at the site.